Hello, my name's Kathy. If you're watching this slide presentation, then you're preparing to vaccinate and or manage the vaccine at a vaccine clinic. The information I will share is based on CDC and CDPH recommendations and Santa Barbara County policies. There are links within this presentation if you would like to review the state and federal resources. Please copy them as you go through the slides. We'll be covering the vaccinator role and the vaccine manager role. The CDC, CDPH, and Santa Barbara County Public Health Department all have specific training requirements for our vaccinators. This is to ensure that all vaccinators are on the same page and can effectively complete their duties. Every vaccinator should have already reviewed the CDC and CDPH updates on the COVID vaccines. Please use the COVID-19 Vaccine Product Guide as a resource when at a clinic and be sure you have the most recent updated guide. Ask your clinic lead for a copy if you do not have one, and one should also be located in the clinic binder kept at the vaccine table. There are several steps that each vaccinator will go through for each vaccination, and we will cover those steps in the next slides. Step 1, the vaccinator determines the need for the COVID vaccine. Question, does client meet the recommendations for the COVID vaccine? If they do meet the recommendations, you can proceed to step 2. If they do not meet recommendations, then you stop and there's no action needed at the time. Step 2, screen the patient. The vaccinator screens for contraindications and precautions. If the client does not have any known contraindications, you can proceed to step 3. If the client does have contraindications to COVID vaccine, the vaccine will not be administered and they need to be referred to their primary care provider or to the on-site provider if at a mass vaccination site. COVID-19 vaccine contraindications are listed here. A history of severe allergic reaction or anaphylaxis after a previous dose or a component of the COVID-19 vaccine. The recommended action is you do not give the same type of COVID-19 vaccine that caused that reaction. A history of known diagnosed allergy to a component of the COVID-19 is a contraindication, and you can see Appendix C for the actions and additional information regarding that contraindication. For the Janssen COVID-19 vaccine, TTS following receipt of a previous Janssen COVID-19 vaccine is a contraindication, or for any other vaccine that is not authorized in the United States, such as AstraZeneca. Do not vaccinate with the Janssen COVID-19 vaccine, and you need to see the considerations for Janssen COVID-19 vaccine for additional information on vaccinating with an mRNA COVID vaccine. There's also a link here for the CDC interim clinical considerations. Step 3, patient education. The vaccinator discusses COVID vaccine administration, provides education to the client or the legal guardian, and obtains consent. Now, the consent and the information may very well have been obtained at registration by administrative or screening staff. So the nurse needs to provide the client guardian with the appropriate EUA fact sheet, allow sufficient time to read the fact sheet, and then answer their questions. Step 4, hand hygiene. The vaccinator performs hand hygiene using soap and water if there's a basin nearby, or alcohol-based hand sanitizer for at least 20 seconds. Step 5, adhere to standard precautions. The vaccinator adheres to standard precautions and applies PPE as per facility policy. Standard precaution link is there. You can take a look at that. Gloves are not recommended for most vaccination administration and are not required for the COVID-19 vaccine unless the person administering the vaccine is likely to come into contact with potentially infectious body fluids or has open lesions on their own hands. Step 6, follow the CDC PPE recommendations. The vaccine pod will follow the CDC PPE recommendations based on the level of infection in the community. Required PPE is a surgical mask and a full face shield. Optional PPE are gloves, gowns, and N95 masks. Step 7, properly verify the patient. The vaccinator verifies the identification of the client prior to providing vaccine administration. Step 8, properly administer the vaccine. The vaccinator administers the COVID vaccine per medication administration and vaccine policies. The CDC recommends that all vaccinators screen all their patients. Although patients are pre-screened during registration, it is important that vaccinators double-check with the patient before vaccinating. The vaccinator should ask the patient if they have a history of issues with the vaccines, such as allergies, adverse reactions, fear of needles. On each vaccination table, we should have the CDC Pre-Vaccination Checklist, which has the list of pre-screening questions that the patient answered on my turn. Each vaccinator should be familiar with the CDC Interim Clinical Considerations packet. That packet contains information on many C19 topics and can be used as a guide to help answer patient questions. CDC also recommends that all vaccinators practice hand hygiene between each patient and maintain a clean workstation. It is also important to choose the correct equipment for your patient, such as the correct needle length, and to check the 5 rights of drug administration: the right patient, the right medication, the right dose, the right route, and the right time. Lastly, if a vaccine error occurs, all medical staff should know how to identify the error and report it. There are some additional safety tips that the CDC recommends all medical staff follow. Triple check labels, contents, and expiration dates or beyond use dates before administering vaccine. Never use expired vaccine or vaccine past the beyond use date. Always check the 5 rights. Again, the right patient, right drug, right dose, right route, right time. Ensure appropriate needle size and technique. Administer the correct dosage by the intramuscular injection. Document the vaccine upon completion. Take corrective action immediately if the vaccine administration error occurs. Put strategies in place to prevent future errors from occurring. A competency assessment is required for all nurse and physician vaccinators. It's preferable to be done before the first clinic, but the competency itself can be done on the day of the clinic prior to the start. We require 3 vaccinations monitored by one of the experienced nurses who will confirm competency. We have a form that we use, and you will be signed off by the nurse who monitors your 3 vaccinations. This is not just the administration. This will include screening the patient, patient education, hand hygiene, needle safety, vaccine administration, and finally, follow-up education with the patient regarding expected side effects, VAERS, and sitting in the post-vaccination monitoring area for a minimum of 15 minutes. This injection technique video may not work. I'm going to describe to you what it is showing. This shows the 90-degree angle of the needle for COVID vaccination for all injection sites. The needle gauge and/or length and site of injection may change depending on the size of the patient or the age of the patient. As an example, what gauge and needle length would be appropriate for someone with very large, thick arms, and why? A 1.5-inch needle, 22 or 23 gauge, and a shorter needle would inject into the sub-Q tissue, not the muscle. Another example is what gauge and needle length would be appropriate for a 3-year-old deltoid injection and why. A 25 gauge, 5/8 or 1 inch needle. A longer needle may hit bone on a small child. Generally, the smaller the gauge, the less discomfort with the injection. The nursing competency form will be used for your competency. Every vaccinator will get checked off using this form as a guide to ensure the vaccinator has the necessary training before they work a clinic. Please review the form so you understand what's required before you have your competency. Complete your self-assessment and bring it with you to your in-person assessment. Vaccine documentation, once again, the CDC, CDPH, and Santa Barbara Public Health all have specific training requirements for our vaccinators. This is to ensure that all vaccinators are on the same page and can effectively complete their duties. This is what the CDC C19 Vaccination Record looks like. It shows how we would document a first, second, or booster. If the person is immunocompromised, they may have a total of 4 vaccines recorded on one card. Typically, we can fit 3 doses on the front and 1 dose on the back. Every COVID-19 vaccine is documented on COVID-19 vaccination card and is the proof of vaccination. The Santa Barbara PhD does not replace these cards, so please remind the patient when you give them the card to take a picture to ensure they have a record in case it gets lost. This is what you're going to see for the electronic vaccination recording in my turn. The scribes will be entering the data. They fill in the vaccinator name, where the injection was administered, and which vaccine was given along with the lot number. That's the information that your scribe will require. If you are also giving flu shots at a COVID clinic and the patient needs proof of flu vaccination, this is the form you would give them. It is pre-stamped with PhD as provider of vaccination, and then they can fill out the remainder of the information that is necessary. As a vaccinator, you may also be the vaccine manager, or you may be a vaccinator drawing up your own vaccine. No matter your role, you need to be aware of the acceptable storage conditions for COVID vaccines since you will be handling the vaccine during the clinic. The vaccine manager role. The vaccine manager is responsible for the vaccine. They ensure the vaccine maintains the cold chain. They ensure the correct vaccine is drawn up with the BUD label visible to the vaccinator, and they prevent waste when possible. The vaccine manager is responsible for monitoring the vaccine and keeping it within the cold chain storage parameters for viability. When this role is filled by nursing, they will also drop the vaccine at the vaccine table for the vaccinators. If a non-nurse is monitoring the vaccine, their scope of practice will determine if they are allowed to drop the vaccine. Otherwise, only nurses are allowed to draw the vaccine, which is another competency required by those nurses who will be in this role. The vaccine manager responsibilities. You may or may not transfer the vaccine from the inventory site to the clinic. If you are responsible for transferring vaccine, you will need to receive additional instructions from the team leader. The chain of custody form is the hourly documentation of the temperature of the vaccine in your custody and the room temperature for the COVID vaccine, as well as how much vaccine you started and ended with, the lot numbers, and how much vaccine was wasted. This is all documented on the front of the document, and the time and signatures are on the back of the document. So let's go over the vaccine manager responsibilities. They transfer and/or receive the vaccine to the vaccine clinic as requested. They maintain the chain of custody form. They sign the vaccine chain of custody form at the beginning and the end of the vaccine. They document the temperature of the DDL, the digital data logger, which is the thermometer that we use in the vaccine transporter, at the time received on the chain of custody form. Transporter temperature should range 36 to 46 at all times. They count the vaccine. Note if there are multiple lot numbers and expiration dates. The amount and types should match the chain of custody form. If not, you inform the pod manager and team leader before the clinic starts. The vaccine manager should be the only staff member that removes vaccine from the transporter and does not remove more than is needed to prevent wastage. This is so that the count does not get off, so that you don't have any questions at the end of the clinic where the vaccine went. You keep the vaccine transporter closed at all times. If the temperature excursion occurs, which would be under 36 degrees Fahrenheit or over 46 degrees Fahrenheit, you notify the pod manager, the team leader immediately, and attempt to return the temperature back to the cold chain range. You check and record the DDL temperature in the vaccine transporter every hour on the chain of custody form. COVID vaccines also require the room temperature to be documented, and the range for that is 44 to 77 degrees Fahrenheit. You can use another additional DDL for that, because you should have an additional one in your transporter as a backup. You train and supervise any vaccine supply assistants at the vaccine table, and you determine who will draw up vaccine, and that is going to be determined by who can competently draw the vaccine up. The general guidelines. The primary focus for the nurse vaccine manager includes hand hygiene and safety for anyone who draws vaccine, cap needles before discarding syringes, drawing vaccine competently, following CDC vaccine guidelines with BUD times clearly visible, and preventing vaccine waste. This applies to any nurse or professional drawing vaccine, whether they are the vaccine manager, assisting the vaccine manager, or a vaccinator drawing their own vaccine. So, general guidelines: all staff must demonstrate safety, hand hygiene, competency for vaccine management, any required diluent procedure, and drawing from vial into syringe. Assure all workers in the vaccine management area complete vaccine management and vaccine preparation training, and complete the management draw-up competency checklist. Prepare vaccine according to manufacturer's directions for temperature, diluent, use within specified time, the BUD, and all other requirements. Keep the different manufacturers' types separate. Assure the vaccine is not wasted. Prepare only the amount needed. And 3 hours in a pod and 1 hour in a small clinic. Work with your pod manager, team leader, to coordinate the amount of vaccine to prepare to prevent waste. Maintaining the cold chain is most important to maintain viability of the vaccine. Although we have found from experience that COVID vaccine is tolerant to temperature changes in a controlled environment, this tolerance is less likely out in the field where there are less resources when a temperature excursion should occur. Always be sure to protect the vaccine. If it is sunny, keep the transporter and any drawn vaccine out of the sun. Keep the lid closed on the transporter to maintain the temperature. Contact your clinic lead immediately if a temperature excursion should occur. The vaccine will need to return to acceptable temperatures as soon as possible, and that's the 36 to 46 degrees Fahrenheit. The CDC requirements. Organizations must comply with CDC requirements for COVID-19 vaccine management. Those requirements include the following. The organization must store and handle COVID-19 vaccine under proper conditions, including maintaining cold chain conditions and chain of custody at all times in accordance with the manufacturer's package insert and CDC guidance in CDC's Vaccine Storage and Handling Toolkit, which has been updated to include specific information related to COVID-19 vaccine. Storage units must be equipped with a digital data logger or the thermometer, devices with a buffered probe to provide more accurate readings, and that's what the DDL has, a buffered probe. Here's another video that may not run, so I'm going to describe what it is. The VeriCore Cool Cube, or the transporter, is what we use for transporting vaccine. We are required to use special transporters for vaccine to maintain the cold chain. We use the VeriCore Cool Cube or transporter, which has tiles inside that have been frozen, then thawed to refrigeration temperature, and they line the inside of the transporter, maintaining the temperature from 36 to 46. These tiles can be a source of temperature excursion. So a question I have for this particular slide is, if you leave the transporter lid open, will the temperature inside rise or fall? It will always rise. It'll go up because you're not going to make it colder, you're going to make it warmer. So always secure the lid after your opening and make sure you put the tiles back in, because there's one on top that typically gets left outside. The chain of custody form is the hourly documentation of the temperature of the vaccine in your custody and the room temperature, as well as how much vaccine you started and ended with, the lot numbers, and how much vaccine was wasted. We've talked about this once before, and this is what it looks like. This is the front part of the form. As you can see, it has the Moderna, the Pfizer, the Janssen, and then the 3 flus that we're currently using are on there also. Up in the very top are all the hourly vaccine temperatures, and then below that is the room temperature. And then we have the wasted, the number administered, and the number remaining. And of course, we also have to write down where it went, where it came from, and where it went. The next slide shows you the back of the form, where you have the times and you have the count at the end, and then the signatures also go on here. This is the Moderna wastage table. CDPH developed this table to be used for waste determination when giving both whole and booster Moderna doses from the same vial, because it was becoming very confusing for everybody trying to figure out how to do the waste. Temperature loggers. The DDL, or the digital data logger, is what we're using. This device is used to monitor the temperature in the transporter. There are 2 parts: the probe with the glass bottle attached and the actual digital data temperature device. Each probe and DDL have been calibrated together as a unit. The probe should never be removed and placed on another DDL, as inaccurate temperatures will occur. The DDL probe stays in the transporter, and the DDL, the actual device, is kept in the sleeve of the transporter. The actual DDL, the device, should not be placed inside the transporter or a refrigerator or freezer. Only the probe stays cool. When placing the probe in the transporter, always place it within or on top of the vaccine, which will reflect the most accurate temperature of the vaccine. Placing the probe on the tiles will reflect the cold temperature of the tiles, not the vaccine. Temperature data loggers. The vaccine storage units must be equipped with a digital data logger. Devices with the buffered probe provide more accurate readings of the temperature environment of the vaccine. CDC recommends devices with the following features, which is what we're using: current, minimum, and maximum temperatures, detachable probe that best reflects vaccine temperatures. We have the probe buffered with glycol, the alarm for out-of-range temperatures, reset button, accuracy within 0.5 degrees centigrade, and a low battery indicator. The DDL used with the PhD vaccine transporters is a digital thermometer with a glycol-filled glass vaccine bottle probe. The probe is to be placed on top or within the center of the vaccine supply in the transporter. Again, the probe is never to touch the sides of the transporter, as it can give false low readings. So questions. How can the DDL reflect a false temp excursion? If the probe touches the cold tiles on the inside of the transporter, it will be reflected on the DDL as a low temperature below 36 degrees Fahrenheit. And it'll be a false temp excursion.